Hi, everyone. My name is Suzanne Tither. I'm a family nurse practitioner here with Rose Wellness Center for Integrative Medicine in Oakton, Virginia. And tonight I'm diving into a really fascinating topic, and that is the mysteries of the thyroid. This webinar is hosted by Rose Wellness as well as Natural Awakenings, which is a great publication in actually the DC area as well as nationwide for supporting holistic and integrative therapies. So a little bit about my background. I'm a family nurse practitioner and an acupuncturist, and I worked as a nurse and an acupuncturist for about 10 years and eventually sought more training in both Western and functional medicine. And that's sort of what led me to where I am today. In my practice, I really try to blend Eastern and Western philosophies of medicine. And my goal with clients is to really uncover the root cause of illness, symptom imbalance, and really recognize a very personalized approach to healing and to health and wellness. So we incorporate diet, nutrition, lifestyles, sometimes medication, herbs, supplements, acupuncture, and even hormone balancing. So here at Rose Wellness, we have a really creative team of providers to serve your healthcare needs. Please check us out at rosewellness.com. And just to let you know, the presentation is going to last about 30 minutes. If you have any questions, please feel free to reach out to us on Facebook. I'm also going to go ahead and provide our contact information at the end if you decide you want to meet with us. So all right, so we're gonna dive in. So first thing is we're gonna just have a little thyroid anatomy 101. And essentially, the thyroid gland is located just in front of the windpipe. So basically where we exchange air from the outside environment to our lungs. And it sits right sort of below the Adam's apple. And it's made of two lobes. And then between those two lobes is a piece of connective tissue. So it's shaped sort of like a butterfly. And that connective tissue actually helps the thyroid mobilize when we swallow. So it gives it some flexibility. Within those lobes are tons and tons of tiny little vesicles, what are called follicles. And those follicles actually contain thyroid hormone itself. And we're going to get more into what the thyroid does, but essentially, globally, it's the energy producer in the body. So it feeds every cell in the body to give us energy and support our metabolism. All right, and then we can't really talk about the thyroid without discussing the endocrine system. So the endocrine system is essentially a collection of glands that produce hormones that regulate metabolism, growth and development, tissue function, sexual function, sleep, mood, and reproduction, among other things. So within the endocrine system, you have the thyroid gland. You also have the pituitary, the pineal gland, the thymus, the adrenal glands, the ovary in women, and the testes in men. And each gland of the endocrine system stores hormones, and those are released into the bloodstream. And then they send messages to the cells in the body. And so this, to dive a little bit more deeply into thyroid physiology, as I said, the thyroid is the energy producer. So if we look here, you see that TSH. TSH is termed thyroid stimulating hormone, and that is an indirect marker for thyroid production. So when thyroid hormones are high, that TSH actually drops, and when thyroid hormones are low, that TSH level will rise. So you can think about it a little bit like a heater and thermostat. And basically what's happening is the pituitary gland, which is a gland that sits in the brain. And if you think about that as a thermostat, and the thyroid, which is in the neck, and that's as the actual heater. If the thyroid gland is lacking hormone and the body starts to get cold, so the heater turns down, the thermostat will turn on, and the pituitary will message that TSH, and that TSH will rise and it'll tell the thyroid to produce more hormone. Now, vice versa, suppose it's getting too hot. Well, that'll trigger the pituitary to send a message saying, no, we need less thyroid hormone, and so that TSH level will drop. And so this is happening all day in the body, all day. And what essentially is, the body is always trying to maintain some sort of metabolic homeostasis. So the pituitary and the thyroid are communicating. All right. So what does that mean for a dysfunctional thyroid? Well, essentially, you can imagine an overactive thyroid, which is called hyperthyroidism, is going to lead to things like sudden weight loss, an increased appetite. Everything's going to get revved up. So maybe a rapid heartbeat, an irregular heartbeat, pounding of the heart. So some patients will complain of heart palpitations, nervousness or anxiety, sometimes a tremor, sweating, changes in menstrual patterns. So some women who develop hyperthyroidism will say they lose their menses, or they might menstruate in a highly irregular fashion. Increased sensitivity to heat, more frequent bowel movements, sometimes an enlarged thyroid gland, which is actually termed a goiter. So I'll have some patients say, oh, I feel this like swelling in my neck, or, I'm having more difficulty swallowing. And then sometimes difficulty sleeping as well. In truth, an overactive thyroid is a little less common than what we're going to discuss next, which is the underactive thyroid. And that is termed hypothyroidism. Oftentimes, this is considered the great masquerader. And the reason being is because the symptoms rooted in slow metabolism or hypothyroidism can mimic so many other things. So fatigue, depression, feeling cold. Remember, if that heater's turned off, person often complains of cold intolerance, weight gain, hair loss, headaches, sometimes constipation, mental slowness. So there's no real diagnosis of brain fog, but I will have, often patients say, my brain just feels like it's in a fog. I can't think clearly. Menstrual irregularities as well. So often heavier cycles, and sometimes an elevated cholesterol. And some of that's rooted in the fact that metabolism is not optimal. All right, so just some statistics. So, just to repeat, the thyroid controls the chemistry and the energy production of every organ in the body. Hypothyroidism does tend to be a highly underdiagnosed condition. So as much as 20 million Americans suffer from improper thyroid function, and up to 60% aren't even aware that they have it going on. Women are 5 to 8 times more likely than men to develop thyroid problems. And 80% of hypothyroid conditions in the US are thought to be driven by an autoimmune condition called Hashimoto's, which I'm going to talk about a little bit more depth in a future slide. And so this is Dr. Richard James, a quote by him. He's the author of Thyroid Power. And as he says, although extremely common, low thyroid is a largely unsuspected illness. And even when suspected, it's frequently underdiagnosed. And when it is diagnosed, often goes untreated. And then when it is treated, it's seldom treated optimally. So as functional medicine providers, we really take the health and the function of the thyroid and the functioning of the thyroid very seriously. And we do our best to personalize our plans and figure out, what a healthy thyroid looks for each individual, or looks like. All right, so causes of low thyroid. Well, one can be iodine deficiency. We do iodize our salt, although I'm finding more patients use sea salt. Not all sea salt is iodized. We also tend to lack a diet of fish and seaweed and sushi in this culture, at least not, it's not sort of the predominant diet for Americans. Autoimmune, I mentioned that. Oh, and let me just go back. So essentially, iodine is actually a building block to your thyroid hormone. So if you don't have proper amounts of iodine, your body can't actually build the hormone. Again, the autoimmune condition, medications and chemotherapy can actually disrupt um, hormone production. So can pregnancy. So it's very common to see thyroid conditions appear when women either before or after or during pregnancy, and any kind of hormonal fluctuations. So women who are going through perimenopause, where they have a lot of dynamic activity with hormone balancing, that can sometimes trigger thyroid disease. Stress as well. So the adrenals are a gland that we talk a lot about with our thyroid patients. The adrenals are two glands that sit on top of the kidneys, and they are responsible for our fight or flight response. So tiger in the woods, that's, our primitive response to something that's threatening us. Well, certainly in this culture, we have a tendency to have high amounts of stress and perhaps things that feel like they're threatening us on a more regular basis than is optimal. And so over time, that can deplete your adrenal function, which in turn can lower your thyroid health as well. Chronic infections, Epstein-Barr, which is actually the virus that's implicated in the mono infection. So as much as 90% of adults by the time they reach age 20 have been exposed to mono, and that can trigger thyroid. So can H. pylori, which is a bacterial infection in the gut. And then, of course, nutritional deficiencies. So, despite the fact, even when you're eating healthy, a lot of our soils are not as nutrient rich, perhaps, as they once were. Depending on what people are eating on a regular basis, they just may be lacking zinc or lacking selenium. Well, all those nutrients help build the thyroid. So, all right, so now we're going to talk a little bit about the thyroid hormone itself, or the thyroid hormone. So there's really two predominant thyroid hormones. There's T4, which is the less metabolically active form of the thyroid hormone, and then there's T3, and that's really what feeds all the cells. And the building blocks to those hormones are iodine, as I had mentioned, and also something called tyrosine, which is found in certain protein foods. T4 has to convert to T3. That's really important. And that process in the body happens with the help of minerals like zinc, selenium, iodine, and iron. You also need adequate amounts of protein and fat for that as well. Some causes of an inadequate conversion would be certain medications like beta blockers, which are often used for hypertension, or Dilantin, which is actually a anti-seizure medication. Alcohol and even pesticides can disrupt that conversion. Nutritional deficiencies. And also here we mention gut or liver dysfunction. So a big thing in functional medicine is we really like to look at the health of the gut, because the gut's where you absorb your nutrients. So if something's not going on well in the gut, that can disrupt your ability to absorb zinc and selenium, and in turn support the thyroid. So it's all really connected. And then here I highlight Hashimoto's. Hashimoto's thyroiditis sounds kind of intimidating, but that is the name of the autoimmune condition that impacts the thyroid. It's very common in the United States. It basically, all it means is that your body, something has triggered an inflammatory response where your body starts making antibodies towards its own thyroid tissue. And so you actually see some of that tissue start to decay. And it sounds scary, but actually it's a condition that's very, very, we're very capable of managing it with appropriate lifestyle, diet, and finding ways to reduce inflammation in the body. Also, certainly sometimes thyroid hormone is important as well. But one of the challenges with it is that oftentimes symptoms will present long before a diagnosis is made. So the statistic is like it takes about 5 years for someone with an autoimmune diagnosis to actually get it diagnosed. And sometimes it has to do with the non-descript sort of symptoms that present with autoimmune, like fatigue or just feeling kind of low. Or so, that again, something that we really hone in on and make sure we address with many of our patients that walk through the door. And then this sort of highlights the medical dilemma in reference to diagnosing thyroid, is that often it's misdiagnosed. So sometimes people are just told, oh, you're just depressed. And, when it could be that the biochemistry is off of the thyroid. We do rely on medical tests for diagnosis, but it's really important to know how to actually read those tests, because you'll find that with thyroid tests, what's normal for one person may not be for another. It's estimated that 1/3 of hypothyroid patients have actually normal blood results. 20% of patients hospitalized for severe depression were found to have Hashimoto's disease. 52% of patients with untreatable major depression have hypothyroidism. So those are pretty profound statistics. And this is just kind of emphasizing that, is it that you're really depressed, or is it that the biochemistry of your body is off and you need a little support? So how do we diagnose? Well, we do a clinical evaluation. We always feel the thyroid and make sure it's not enlarged. We do laboratory tests. So we'll do a blood draw. Sometimes we'll do a body temperature analysis. So I think I mentioned with hypothyroidism, the body can get cold, and actually people's temperatures tend to be on the lower end. So sometimes getting up and taking a basal body temperature in the morning can be some valuable information. And then we also look at the health of the adrenals as well. All right, so this is sort of highlighting, understanding the lab values that we're reading. And so, some of you may have had your thyroid checked at your primary care practice. Typically what they'll do is look at a TSH. And again, that indirect marker for thyroid function. So remember, as that marker rises, that means you likely don't have enough thyroid hormone generating in the body. Okay. So the normal range on a laboratory, from a laboratory facility tends to be about 0.35 to 5.5. But in truth, we know optimally, for optimal metabolism and optimal health, most people feel better when their TSH is between 0.5 and 2.5. And keep in mind, these are pretty short reference ranges. So what I mean by that is, like, if we had a lab value where the reference range was, say, 0 to 5,000, well, then we know that maybe the difference between your value being 200 versus 300 might not be so significant. But when you have a short reference range, 0.35 to 5, we know that, like, the difference between perhaps a 0.35 and a 3.5 and how you feel in your body could be very different. And for years, I've worked with thyroid patients, and what I know to be true is that we have to find that individual sweet spot. Some people feel great when their TSH is at a 1. Another person needs it to be at a 2. It's just figuring out what's optimal for the individual. The other thing is that, and I find this kind of interesting, is that reproductive endocrinologists, so when they're working with women who are attempting pregnancy, they do their best to keep that TSH at 2.5 and below. Remember, that means you have good thyroid production. And they do that because if your thyroid's low, you could be more prone to miscarriage. So I think it's kind of interesting, we'll optimize the thyroid for a woman attempting pregnancy, but it's likely that that's where other, person who isn't even attempting pregnancy would feel best. Okay, so then what we always check for is that TSH, the thyroid hormones, which are the T4 and the T3. We also check something called a reverse T3. So sometimes when the body is under stress, instead of producing actual thyroid hormone, it will produce sort of a blank thyroid, or a blank thyroid hormone, and it's sort of not usable, but it'll still make it seem like the lab values, like the TSH, is within normal range. So we take careful attention towards that. And then we do look at thyroid antibodies as well if we're suspecting an autoimmune condition. All right, so this is just another example, or just highlighting sort of normal versus optimal. So we really want you to be in that happy zone. And, I've had a lot of patients come to me saying, the doctor told me, and no fault of their own, but that, all my tests are normal, but why do I feel so horrible? And sometimes that could be, well, maybe you're down at that low end of normal and you really like to feel here, or you like to feel up in the high end. All right. Oh, a little problem here. Okay, there we go. All right, so then let's see. So what are some of the other laboratory tests that we look at? We will look at male and female hormones. We'll look at adrenal hormones. We'll look at vitamins and certain mineral deficiencies to see if they're present. Sometimes we'll go as far as to look for chemical or heavy metal toxicities, which can impact thyroid production, thyroid hormone production. And we do take a look at chronic infections. So, even the health of the gut. So the gut, is where we hold about 80% of our immune system. And certainly if you have Hashimoto's in particular, which is an autoimmune issue, we want to do anything we can to keep that immune system optimal. So we'll look at the gut for infections like bacteria, yeast, parasites, because that can certainly be a problem. And then food intolerances as well. Gluten's often a big one for patients with Hashimoto's. It's a very pro-inflammatory food. So sometimes we'll get you off of gluten. And then how do we manage? Well, sometimes hormone replacement, either synthetic or natural. We correct vitamin and mineral deficiencies. We improve on the diet and nutrition. We correct hormone imbalances, and we'll treat any infections and promote healthy detoxification. And just so natural isn't, the way I see it as a provider, natural isn't always better in terms of a medication for thyroid. Some people do very, very well on synthetic thyroid hormone. This would be things like Synthroid or Levoxyl. Sometimes we'll add a little bit of T3 as well, which is Cytomel. Sometimes we will compound T3 into a sustained release form so that you get little bits of it in your body throughout the day. If we opt for the natural thyroid, this is actually desiccated or dried thyroid gland that's derived usually from porcine. And things like Armour thyroid and NP thyroid are examples of that. And the difference with natural thyroid glandular is that it actually contains a little bit of T4 and a little bit of T3 within one capsule. And then nutritional supplementation, we'll take that very seriously. We will sometimes give iodine, although you notice here that's a double-edged sword. All that means is that while you want iodine, you don't want to overdo iodine, because as much as low iodine can be an issue, and overuse of iodine can actually lead to too much thyroid hormone production and that hyperthyroidism that we talked about. So we have to evaluate the individual for proper dosing. Selenium, zinc, vitamin D, E, B complex, fish oil, and of course amino acids are important. And so how do you prevent developing a thyroid condition in the first place? Well, eating a really balanced, diversified diet, taking a good multivitamin, keeping your stress managed, and also water is just always a good thing, 6 to 8 cups per day. Dietary guidelines, we're pretty pro diversified diet, lots of fruits and vegetables, good proteins like meats, fish, beans, lentils, healthy fats, avoiding those refined carbohydrates, white flour products, iodine-rich foods like fish, green leafy vegetables, and sea vegetables, selenium-rich foods, Brazil nuts, onions, fish, eggs, Note here, we say be cautious of the high amounts of raw cruciferous vegetables. So, cruciferous vegetables are things like broccoli, cauliflower, cabbage, Brussels sprouts. Amazing vegetables. I'm a big advocate for them. We know they carry a lot of antioxidants and they help reduce our risk of cancer. But in their raw form, they actually can aggravate the thyroid. So we generally recommend thyroid patients actually steam any of their cruciferous vegetables or cook them. And then we always have to look at food intolerances. So big culprits for patients with Hashimoto's would be soy, dairy, and gluten. All right, so it was great spending the evening with you all. Thank you so much for taking the time to experience this webinar and learn how we can help you with your thyroid conditions. We love sharing this topic with people eager to transform their health. And here we go. We have our phone number to reach us at Rose Wellness Center for Integrative Medicine. It's 571-529-6699. And again, you're also welcome to reach out to us on Facebook as well. Okay, take care. Bye-bye.